Breast cancer is actually a most common cancer in the UK. One woman is diagnosed every 10 minutes.
We found out that the cancer can be releasing some DNA fragments of the cancer cells, and in the blood sample we're able to detect them, and through them we can run tests and find things like genetic mutations.
There was something that she inherited from her family because she was negative for like BRCA1, BRCA2. And then as this gene testing really evolved, we now are able to test for so many different genes we didn't even know before we had any involvement in cancer, like breast cancer.
It's called Know Your Lemons. They put it in a picture of how your breast can show symptoms, like how a lemon can go wrong.
Hello everyone, welcome back to Nadia's Lab. This October, Pink October, the Breast Awareness Month, and I decided to do something special in order to help raise awareness. So today I'm actually joined by Chloe. Chloe is a specialist breast cancer pharmacist working in world's leading cancer hospital, and we are going to have an eye-opening conversation about breast cancer, give you some information about some key aspects of it, and also discuss the role of the hospital pharmacist in breast cancer, as well as how can we all help raise awareness and possibly save lives. Chloe, thank you for joining me.
Yes, lovely to be here.
I have a huge pleasure having you here. I worked with you, and I know that you are such an intelligent, successful young lady. So thank you. I wanted to start by sharing a couple of facts that people might know or might not know. But breast cancer is actually a most common cancer in the UK. And one woman is diagnosed every 10 minutes. So during the length of this podcast, it might be 3 or 4 women diagnosed with breast cancer. And then you probably know even more statistics about it and how common it is. But is it true that 1 in 7 women in the UK will be diagnosed with breast cancer in their lifetime?
Yeah, that is the data we have in the UK. It is really scary if you think about it. I'm sure you have like 7 friends with your family that are women. And if you think about it, 1 out of them would be having breast cancer. That is quite a lot.
That is very common.
So that's why it is very important to raise awareness so everyone is aware what breast cancer is. And it's not only about UK, it's also about worldwide as well.
Yeah.
As per the data we've got from WHO, breast cancer is in every country. So definitely something that we should all be aware of.
Exactly. And this whole Pink October, I'm wearing pink.
I tried to wear pink.
This is baby pink, guys. This is very bright pink. So what do you think are some pros and advantages of doing this, like Pink October?
Yeah. So obviously I have to say it's one of my favorite months because it's all about breast cancer. The reason why it's quite important to have Pink October is it can really raise awareness.
Yeah.
When it comes to breasts, people might be scared or feel like they can't openly talk about it. But having this, it encourage open discussions, raise awareness, a lot of fundraising, which is crucial for a lot of research.
Absolutely.
And many, many other service that we provide to patients.
And you think there are any disadvantages of this? Like, are there any cons of this Pink October?
So I think because it's pink, so people will be only associating it to female.
Yeah, that's true.
But it is also a cancer that can happen in men.
Absolutely.
So it could be underrepresenting certain groups. So I think that's something that maybe Pink October didn't potentially cover.
Yeah, what I was actually shocked, and I probably wasn't aware of this myself, but 1 in 100 cases of breast cancer is in men.
Yeah.
And people are not aware of that. I personally, I love the Pink October like you. And I worked for almost 3 years in cancer, a bit less than yourself, but it's definitely, that's been the best part of my career. And and especially because I used to visit breast cancer clinics, and that's where I kind of wanted to specialize in. I take this like very emotionally as well. And I do love the whole idea of Pink October. And what I find really cute is the pink ribbon. How, you know, we all started, because we've been seeing it so much, we kind of started associating it with breast cancer, which I think is doing a good job at raising awareness. Because obviously, as people who worked in cancer, we are kind of like, we think about it all the time, but you have a lot of people who just, you were lucky enough not to hear about it, right? So I think it's good. And something that really was kind of, I will never forget, last year I was in Paris, and Hotel Peninsula, actually every October since like 2013 or earlier, they light the whole building pink every night.
Aww.
And I think Eiffel Tower was pink as well.
Yes, it is.
I don't know, is it every night or just some nights in October, but I really think that's nice and doing a good job at raising awareness. Now, on the contrary, we kind of have to talk about as well the negative aspects, which is the so-called pink washing. And that's basically these big brands and, you know, industries, corporations kind of profiting from pink branding without actually doing any action or raising any awareness. I mean, maybe they are raising awareness, but they're not really contributing as much as they could, given, you know, how big their companies are. But that's another story. I genuinely think still, overall, it's a good thing. And can you tell me and the listeners, I probably need a refresher as well, types of breast cancer. So how do we kind of, like, broadly speaking, how do we divide them?
So this is a really good question. There are so many types of breast cancer. I can go on and on, but I'll try to keep it as simple as possible. So one of the common way in terms of types of breast cancer is looking at the receptors. When I say receptors, is what the breast cancer respond to. So one of them is hormone receptors, and commonly when we say hormone, we're referring to estrogen and progesterone. So these cancer will be sensitive to them. And I think it's the most common type.
Yeah, I think 70% of cancers are estrogen receptor positive. So they're driven by hormone estrogen.
And then the second type would be, people talk about HER2, if you've heard of it. So it's human epidermal growth factor 2. So essentially it's expressed in some breast cancer, but thankfully there's actually some drugs that can target this receptor and have really good outcomes.
Yeah, absolutely.
And finally, we have triple negative, where we can't find any major receptors that we can target. And for these, we have treatments such as the good old chemotherapies, and up and rising in this field is immunotherapy.
Oh, yeah. I'm guessing triple negative breast cancer is the trickiest to treat because we don't have that specific target. But then also, so this is by hormone, kind of molecular, by receptor. But you can also differentiate them by where they are.
Exactly.
Kind of.
So people might call it like different stages, but essentially it is where the cancer is. We usually call it early breast cancer when it's confined locally more to the breast. We can call it locally advanced when it spreads to the armpit with some node or involvement, but it's still, I would say, rather around this area. But of course, we'll call it metastatic when it starts spreading to other parts of the body, such as the bone, liver, brain, etc. And as I said, there's so many ways that we can differentiate it. We can look at it under the microscope to see how it differentiates, the size of it, many others. So I won't go into details about it, but it's important for us to find out the type of breast cancer. Patients come to us and say, my friend had that treatment, why am I not having it? But even within breast cancer, there are many types of treatment and types of cancer. So it's important to find out what it is so we can target it effectively.
Okay, so what it is, where it is, will basically decide on what treatment you get. And in terms of diagnosis, very quickly, there's a thing called triple assessment. Can you tell me a little bit more about that?
So when we say triple assessment, first of all, is in clinical examination. That can be done by a healthcare professional, literally feeling your breasts, feeling maybe your armpits as well to see if there's any nodal involvements. And then we will either usually do a mammogram, which is essentially an X-ray of your breasts. And sometimes occasionally an ultrasound. And the third thing that we tend to do is a biopsy. So what biopsy is, essentially, we will take a bit of your cells, so we can look more into it and confirm, is it actually a breast cancer?
Okay. So that's a triple assessment. And then in terms of treatment overview, like you said, there are lots of different treatment, but like broadly speaking, how would you divide the treatment options?
So I would say some options that we'll first consider, let's say surgery, because
Yeah.
if you have a lump in your breast, there are a few surgeries that we can consider. We can do what we call a lumpectomy, which is essentially taking the lump out.
Yeah.
But depending on how your cancer presents, we might also need to do a mastectomy, which is taking the whole breast out.
Yeah.
And then the next thing that we tend to consider is radiotherapy.
Yeah.
Usually after surgery, if we find there might be some remaining cancer cells that we didn't clear properly, then radiotherapy could come in very useful. It's essentially high dose X-rays that helps us to kill it.
Okay, interesting.
But I must say I'm no expert in these two, so it's very brief, but that's something we would definitely consider. And of course, as a pharmacist,
something you are expert in,
of course, is the anti-cancer, like systemic anti-cancer treatment. And again, even within this, there's so many of it. So hormone tablets, as we said, some of them are hormone sensitive. So we give some tablets or injections, which essentially switch off the hormones in your body. So it no longer feeds the cancer. So it hopefully controls its growth.
Yeah.
What else have we got? We've got the good old chemotherapy, of course.
Yeah.
Which essentially kills the cancer cells.
Yeah.
We've also got, as I've mentioned previously, we've got immunotherapy, which stimulates our immune cells to fight the cancer.
Yeah.
And then there's so many other targeted therapies that we can potentially give, especially targeting certain like genetic mutations.
Absolutely.
But I'm sure there's many more that I forgot to mention.
No, yeah, I think
it's a great landscape.
it's the hormonal treatment, the immunotherapy, and then the standard chemotherapy, which kills the rapidly dividing cells. And you mentioned new treatments for based on genetic mutations. And something I wanted to share, and something that will kind of stay with me forever, I think, till the rest of my life and career. When I was working in cancer hospital, and I had a pleasure of shadowing a consultation in a genetics clinic. So it's a clinic that really focuses on just finding, which genes were faulty. And we had this patient who was diagnosed in her very early 20s with breast cancer. And at the time when, she was diagnosed, we looked into what caused the cancer, but however, we couldn't find the cause or the mutation, the gene mutation. So hence she was diagnosed with a sporadic breast cancer, so kind of breast cancer of unknown cause. We couldn't say that it was hereditary. It was something that she inherited from her family because she was negative for like BRCA1, BRCA2, and the main genes that at the time we tested. And then as this gene testing really evolved and improved, and the number of genes we are testing has expanded dramatically, we now are able to test for so many different genes that we didn't even know before we had any involvement in cancer or like breast cancer. And unfortunately, she passed away, which was, again, super challenging for everyone in hospital, and obviously her family and everyone who knew her. But from her stored DNA, they were able to repeat that and actually find that there was a gene mutation, a faulty gene, which she inherited from one of her parents. And then her parents were offered to see who it came from. Was it from the mother or the father? And this way, by checking who it came from, you can actually tell that part of the family. If it came from the mom, then mom's side of family can just look out for and do the screening earlier and basically be aware and hopefully prevent late detection of cancer. And for the dad, it can also mean if not breast cancer, then he might be if he does have that gene mutation, then he might be more likely to get something like a prostate cancer as well. Now, this is, again, I'm not a gene expert, and if people want to read about it, let me know. There's so many studies that I can share with you, but for me it was such a touching moment as well. But essentially, it's great that we are improving and able to test for so many genes. There has been so many kind of breakthroughs
Yes,
in
definitely
genetic
a
testing.
lot of breakthrough. So you've mentioned about the BRCA mutation.
Yeah.
We've got drugs that can target that.
Yeah.
So that's amazing. And in the landscape, we've got things like a bit of jargon here. Things like PIK3CA, ESR1. We're starting to pick up these genetic mutations, and we have quite a lot of drugs in the pipeline and also already available in the market in order for us to target them and treat breast cancer.
What an exciting time to be a pharmacist working in breast cancer, right? Not many people know how much, pharmacists, like the role of a pharmacist in breast cancer. So I personally, when I worked in cancer, I was involved in a lot of operational duties. So one of the things pharmacists do is operational duties, which means like screening prescription. So there is a chemotherapy and I'm checking, is this safe and appropriate for this patient based on this patient bloods, based on this patient's past medical history, age, weight, and based on what other medication patient is on, but also answering a lot of queries, both from consultants, prescribers, patients. I used to, especially when I worked private, I used to be kind of one of the first people those patients would see just after they received the chemotherapy for the first time. And I would go and sit down with patients, sometimes for hours, telling them how to take the supportive chemotherapy and often answering so many questions that, obviously people are shocked, they're confused, and they come up with so many questions. And honestly, it was very emotional doing this job, but I think it's personally, I find it very rewarding as well. But there's so many other things that you can do as a pharmacist working in cancer.
Yeah, so pharmacy is definitely, as you said, an integral part of the team.
Yeah.
A lot of us are slowly stepping up and taking up more responsibility, especially we all know about the workload in all healthcare across the world. So if the pharmacist can take up more responsibility, that would be amazing. So something that I really enjoyed in my role is now I'm doing my own prescribing clinic, which I run alongside the main clinic. Because after all, I shouldn't be calling that myself, but we are medicines expert.
Yeah, we are.
So, so some things that I really enjoy is actually speaking to patients, understanding their toxicities, seeing how we can optimize their medication or prescribe any supportive medications for them. So that's something that I really enjoy. And apart from that, what we always forget, pharmacists actually do a lot of background work. That's how I feel. So one thing that I've been constantly working on is just looking at some pathway. How can we make it easier for patients and improve the service in general?
Yeah. So what's something new and exciting right now that you're working on? Yeah. Because I know you're working on so many projects in the background.
Yeah. So I would say two main things, I would say. One is because we talk about AI, we talk about digitalization. Yeah. So one of the very exciting projects that I'm working on right now is looking at what's called EPROMs. What it stands for is Electronic Patient Reported Outcomes and Measures.
EPROMs.
There's a lot of studies about it. And what essentially is we send a questionnaire to like apps on patients' phone. So they can fill in the questionnaire, tell us their symptoms or any side effects that they have. Yeah. And then we as healthcare professionals can look at it remotely, track the symptoms, have like any early detection of any input that we can have, and just a better patient experience so they don't need to keep coming into hospital. Yeah. And even help us stratify which are the higher risk patient or patient that needs more attention, which one are like more stable and we could actually issue the medications easier.
Absolutely, so that's great.
Yeah,
it's very, very interesting. Is there anything else that's happening behind the closed doors that you can share with us?
I wouldn't say it's closed door. If you've read the news in the NHS 10-year plan, we always talk about making it easier, more accessible treatment for patients. So another big project that I'm very passionate about is bringing treatment closer to home. Yeah. So sometimes you don't think about it, but if you're a patient, you need to come to the hospital every month, some of them every week. So there are a lot of conversations to see if we can deliver these chemotherapy or what we call anti-cancer treatment at home. So we are establishing some pathway where a patient can self-administer an injection themselves with training. and also maybe home care nurses going to their home to do the injections. But of course, it seems quite straightforward, but you think about it,
There's so
a lot of
many,
logistical works that
a
we
lot of things
actually
can go wrong, basically. Yeah. Okay, interesting. And I read something about this ctDNA liquid biopsy.
Yeah.
Is that something? It sounds like rocket science a bit to me. Is that something you can tell me a bit more about?
Yes, so it is definitely something up and rising, and it's all over the news. So essentially, what it is we take your blood sample,
Okay.
and then because we found out that the cancer can be releasing some DNA fragments of the cancer cells, and in the blood sample, we're able to detect them. And through them, we can run tests and find things like genetic mutations that we've talked about. So it is getting more and more prevalent, not only in breast cancer, but any cancer.
Amazing. That's really interesting.
Yeah.
We are improving, right?
Yeah, there'll definitely be a role. Not sure if might eventually go to like helping detection, but right now it's definitely helping us to guide treatments and telling us how we can approach this cancer.
I wonder if that can be used for other things as well in the future. We also wanted to talk about the impact of outside of cancer, and like we talk about, obviously we are very focused on like, okay, what kind of cancer it is, molecular background, let's treat it. But, and you know, getting all the scans and treatment, but you know, there is this general impact on patients, and it goes far beyond the physical illness. It affects emotions, self-image, relationships, and day-to-day life. If you know, speak to someone who's gone through it all, you know, they really need support, and quite often the family members as well need a support as well, and because it can have an impact on their career, on their relationship, on a lot of different things. And what you mentioned as well is actually there's men with breast cancer.
I feel like they are always overlooked, because imagine being in the breast clinic, you're waiting outside, you're the only man amongst all the women.
That's true.
They would feel like they're being looked at. There's always this stigma that they think it's just a female cancer, but it really isn't. There are men with breast cancer. So it's really important to be able to discuss this widely, give the support the patient need, do any necessary referrals to ensure they're supported in many other ways. There are some really good support networks so they can connect with other breast cancer male patients around.
Absolutely. And obviously we need to be able to offer that support. And then sexual health and intimacy concerns, both for patients and their partners. We mentioned that like 70% of breast cancer cases are estrogen driven. So, you know, hormonal therapy, which is given, can cause hot flushes, sexual loss of sexual drive, vaginal dryness, erectile dysfunction, right? And all of this can affect your relationship with your partner, and also the body image and how you look at yourself, maybe post-surgery and everything. So there is, again, a lot of support that's needed, and what can help is the, you know, non-judgmental conversation to reduce the stigma, as you said, signposting them to a sexual health specialist. I've done a few episodes with like some fertility specialists who offer egg freezing, embryo freezing, which is something that, you know, those patients might need to consider. And it's good as a healthcare professional or even as their friend to just be able to mention that, listen, yes, you might be infertility, you can't have, but you can, there are things you can do. And, you know, the world doesn't end with your diagnosis, and you just need to be strong enough and learn how to live with it. But also advising on also like practical management, like using moisturizer, using lubricants if you have like vaginal dryness, bone health, and managing these symptoms. But really, I think encouraging, you know, patients and
just to talk about it.
Exactly.
It feels like a taboo. They don't like, if sometimes if you don't ask patients, they don't talk about it. And patients are scared to bring it up. But that's very important. You can't just overlook it. So there has been a lot of talks that we should always bring it up to patients. If they don't want to talk about it, it's fine. But if you ever have this concern, it's always important to have an open discussion with the healthcare professionals, as Nadia said, there's so many options or support that could be available.
I agree. And let's talk about prevention and early detection. So as far as I'm aware, screening wise, so that's like testing for the breast cancer, NHS invites women 50 to 70 years of age for mammograms every 3 years.
In the States, I think they bring the age even slightly lower.
Oh, okay.
Yeah.
That's good. And if someone is at high risk, it might be even more frequent than every 3 years, and that is free of charge. You just need to be registered with your GP.
Yeah.
And also something that again is not very, obviously mammogram, great, go to your GP, but just like know your body. Be aware of what the kind of symptoms might be, and then if you see sudden change in shape, change in size, seeing a lump or skin dimpling, nipple change or nipple bleeding, that should kind of alert you, okay, I might need to see, it might not be anything, but I might need to see the doctor.
Definitely. Yeah. So you've talked about most of the symptoms really, but I always say patients know themselves best. You know about yourself.
Yeah, absolutely.
We always say when you're showering, maybe once a week, have a feel in your breast to see if there's anything abnormal.
Yeah.
And you can always flag it up to your doctor or a healthcare professional. There's actually a really, really useful guide that I love sharing. It's called Know Your Lemons.
Know Your Lemons, okay.
They put it in a picture of how your breast can show symptoms, like how a lemon can go wrong. Okay. So if you can attach that so all your audience can have a look at it. So it shows like skin changes or like pain and things that you've mentioned just now.
Amazing. So know your lemons.
Yeah.
And we're almost approaching the end. So first of all, I just wanted to ask you this before. Would you recommend for any young pharmacists watching this, would you recommend going into, your career, following your footsteps in this kind of career? Would you say yes?
Of course, I would say yes, but obviously there is a biased answer. There is a lot of challenges in my role, but I must say I am really, really enjoying it. It is for such a good cause, and cancer itself, it's increasing essentially, especially with the increase in life expectancy. It's so common to have someone around you with cancer. So it's so important to stay vigilant, be aware of it. And as a pharmacist, there's so much we can do.
Absolutely.
Definitely join us.
Absolutely.
Right?
And for our listeners, I hope you found this informative and learned something new. And in terms of how you can get involved, so one option is, for example, to donate. You can donate to charities like Breast Cancer Now, Copafil, Future Dreams, Maggie's, Macmillan, Cancer Research UK. I'll leave these names and some links in the description of the video below, so check it out. And other things like you can volunteer.
The cancer charities that you've all mentioned have amazing support and things. So I myself have just did a bit of fundraising for breast cancer now. I've ran a half marathon in London.
Oh wow, congratulations.
Well,
how was it?
It was really tiring after, but it's definitely worth it, I would say. It's for an amazing cause. People do bake sales for it. Some company do like wear pink days and things like that. So there's so many opportunities that we can be involved, or even simple things. If you know your someone, not your family or friend, that had breast cancer, just talk to them, see if there's anything you can support them with, like childcare or even like looking after the dog.
Absolutely. And having a conversation with them sometimes, maybe they're lonely. And also like encouraging your loved ones, family members, friends to, get checked if they know something's wrong, and just to go through that, checkup if they're eligible. So yeah, that brings us to an end. Thank you, Chloe, for joining me. This was really, really brilliant. And it's so nice when you're working in something that you're very passionate about, and that makes you be even like better at it. But for you guys, I hope you like this. Don't forget to subscribe and join me next time as well. Bye.